success is being able to get care however, whenever you want.
I would think it's the ability to connect with someone to help you meet your needs, whatever they may be.
It is about getting care when, how, when I want it.
Care when, where, and however you want it.
But that's not how it is today.
How do you choose your doctor?
I check out, the profiles and stuff like that online.
Oh, really? Can you tell whether a doctor's good based on what you see them?
No, not necessarily.
Normally, I'll be honest with you, I don't choose a lot.
You know what?
I mean, I'll go and I'll say, hey, insurance, who are your care providers? Then I see what's closest to me, and that's usually the person I choose because I know if it's closer, I'll make it.
Is that how you pick this one?
Yes, ma'am.
Okay.
I don't get to choose. They give me a doctor, and that's what I got to take.
How do you feel about that then?
I don't like it.
When you need an appointment, can you get one?
Yeah, some of the time, not all the time, because a lot of them be crowded. Like right now, I'm waiting to get a wheelchair. I qualify for an electric wheelchair, but, I can't jump in front of people just because I qualify.
It takes a while, you gotta wait a couple of weeks.
About 3 weeks to a month if I call in.
I gotta wait my turn.
I think about the digital world that we live in today. I mean, a friend of ours ordered a couch and it was delivered the next day, right? If I can get a couch the next day, how can I not see my provider for 3 to 4 weeks? I think we definitely do need to have digital solutions, but we have to acknowledge that won't be the end all be all.
One of the things that we've been kind of thinking about is there's a fast thinking, slow thinking that goes on in healthcare. There's the fast thinking of I'm young, relatively healthy, and I've got this issue that I just need taken care of. And so we built all kinds of technology to kind of, give you kind of instant on-demand access to, something that's, acute, but not life-threatening, and think retail healthcare, urgent care, or whatever online. Then there's this slow thinking piece where you want to develop a relationship. And right now we've got profiles and ratings and reviews and things like that, but there's something really missing.
There's an intermediate step before you can get there. And it has to be, who are they talking to? Is it a trusted person? And so that's why trust is so foundational for what we do at Grapevine Health.
In our user research that we did this last month, that came up as a theme. And what people asked for was, before I make an appointment with a provider and commit to that person, I actually want to do a one-on-one interview. I want to interview the person to make sure that I'm going to have a connection and that I'm going to be able to trust that individual to treat me the way that I want to be treated.
The big challenge for patients is that they're auto-assigned a doctor. So they're basically just going down the list. When they get a new person, okay, this is Dr. Fitz is the next doctor on the list. So that's who you get. I have no relationship with these people. Sometimes I don't even know they've been assigned to me. And that's why people go to the emergency room, because they can't be bothered to go and figure out, okay, who is this doctor and where is she? And I need help right now. Let me just go in the ER. Yeah, I might have to wait for 5 hours, but at least I'll get my issue fixed and I don't have to jump through those hoops to deal with this new doctor. It's a lot like dating, right?
Everything is interconnected, and it's all built upon a foundation of trust. And that trust has many levers and many pieces, like even how you select the provider, what is the provider's presence, how is the clarity of communication, and how they're giving support and information to the patient.
If I had to put a ballpark figure on it, around 7 to 8 years, I had not been to see a doctor.
Why?
I am horrible with taking care of those sort of things, like most men are.
Why?
With men, we're horrible with those type of
Why?
things. And I'll be honest with you, to some degree, it is a bit of the stigma in my mind of, it's like going to a mechanic. Go to the mechanic, you say, hey, I got a problem with this brake light, and he go, oh, but your transmission about to go out. So I always thought kind of the same, so I had the same sort of mind state towards going to see the doctor. I go in there, I say, hey, I got this cough right here, but you know that's because you got heart disease, right? So that's what kind of kept me on that sort of track with doctors. I'll be totally honest with you.
What would you like to have had access to help you make a decision?
Information.
From who and how?
From a lawyer, from a doctor, anybody that could tell me
these
something.
These are doctors. How would you decide if you could trust the information from the doctor?
You can't. What you got to do is you got to research yourself.
Yeah.
You know, you got to go in there and hit it yourself and see what's going on with this thing. How do you deal with it? How do you stop it? What's the cure for it? What can you do about it? Are they right? Are they wrong? Is there another way they could have did it? Which I found out there was another way. Because as you see, with the same thing happened on this knee.
So, you know, that's a lot of complex information. So even if you do your own research, what kind of help would you need to sort through that?
I would need somebody who knew something more about this than I do.
Having an advocate for the patient to really explain the medical things in a simpler term. You know, like when I say doctors, they come in and they'll tell the patient something, and you can just tell the patient doesn't understand what's going on. You know, you can by nonverbal cues, and I guess I will explain it to them. But I feel like if a patient had someone in their family as part of the medical system, or someone they trust as part of the medical system outside of the doctor, a second opinion, like he could have got, I don't know his situation, how accurate it was, but if they had a second opinion, that would help them either feel more comfortable about making a decision, or make it seem like they're making the right or wrong decision and come to a decision. Yeah, I think that's huge. You know, I'm usually the person in my family to be the medical word, translator, you know. So I think that having an advocate outside attached to the hospital, it shouldn't be affiliated with the hospital. It should be a separate entity that can come in and explain things to patients, you know, help them make the right decision. You know, again, doctors going in quick, in and out, people are moving fast. Things are moving fast in the hospital because, like you said, he had a bacteria on his knee. That's kind of, you know, it's moving fast. Doesn't have any time to think or even make the decision. Someone outside that he can trust, or an independent person, come in and really explain what's going on.
And most people don't understand cars, but when you go to the mechanic, they will open the hood for you, show you where the problem is. They will show you the report. But when you go to a provider and something is wrong, they just say something is wrong. There's no transparency. You don't get to see the labs in many cases. Happened to me personally when I kept asking, where can I see my labs? Can I see my labs? No, I had to actually go to another provider, have my labs transferred, and then get that provider to show me the lab. So it's, again, the lack of transparency with what's going on that prevents that trust.
I think we have to find ways to get the information to people through messengers that resonate. The young man in the video used the word translator, and I've often said that too, like that's what people need. And I also believe what's missing, and we're thinking about this too, is how you add humor. So I don't know if you've seen Key and Peele, but they have this guy who's the anger translator. And so I think there's a way for us to also do that with healthcare. And maybe it's an app, or maybe it's, on demand. Someone can send you a message, send a text message like, Dr. Lisa, the doctor said I had hypochondriasis. I don't know. And what does that mean? So I think there is a way to do it so that it's very engaging for people.
The biggest thing I took away was what Dr. Lisa was just talking about, which is it's education, a narrative, and in a format that somebody's going to accept, right? So that it's going to resonate with them, and it can't be you know, clinical expert in a lab coat using language that probably doesn't land, you know, that's not going to be effective, right? We've got to personalize it and those types of things.
A lot of them shared the same perspectives of the people on the video about, well, you know, the technology is nice, I'll try it, but I would really just like to be in person. So I think that's a hurdle we'd have to overcome to really increase adoption or uptake of technology across, you know, these communities. There's some education, you know, the digital literacy is super low. So we have to address that, I think, in order to really increase and sustain adoption of technology.
Yeah, I think about, you know, the centering model for pregnancy, right? And thinking about how do we use group visits. I think digital enablement of that connection to other people who are in a similar situation at that same time as you. So you can say, this is what I'm experiencing, and have somebody else say, I had that same thing, right? How do you normalize that? How do you start to demystify it? And I don't know, maybe it's then moderated by a provider, right? By an expert. So we're not getting, you know, you're not looking to each other necessarily for clinical advice, but you also have the support of somebody else that's in it with you at the same time.
But they diagnosed me with all these blood clots in both of my lungs 2 days ago. So I'm very stressed and I'm scared. I don't even know what that means. They put me on these blood thinners at 40 bottom. Well, I just don't get it.
Did they give you a follow-up appointment?
No, but they gave me a discharge paper and told me to follow.
So you were in the hospital,
Yeah.
and they didn't give you an appointment to see a healthcare provider?
They told me to follow up, but it's no name, no doctor name. Where they
Are you inviting me to look at this paper?
Yes, you can look at it.
Okay.
You definitely can look at it. Because my chest is a little tight and it's scary. So.
How long were you in the hospital?
For 2 days, 2 or 3 days.
Did you ever leave the ER?
Yeah, they took me up on the fifth
upstairs.
floor.
Okay. Yeah. Did they tell you anything about your blood work, or?
No, they gave me medicine.
Do you have a doctor?
No.
When was the last time you had a doctor?
Probably since I was pregnant in 2019 when I was going there.
Oh, so that was your only doctor?
Yeah.
Are you looking for a primary care doctor?
Yes, I am.
Okay, and what I'm hearing from you is that you had a very serious problem in the hospital, and they discharged you without properly connecting you to the next step, and that's a problem.
Yeah. It was nothing but God that when I came off the elevator, I seen y'all right with that, because I was going to ask on that.
Yeah, I can talk to you a little bit about what happened here.
Yes.
We have to get you a primary care doctor. We can help you follow up and figure out the next step.
Okay.
Yeah, that's. I think that's the story that happens over and over and over again in our health system. It's the lack of seamlessness and continuity of care.
Someone like that lady needs a warm handoff. But you know what's so appalling, and just watching it again just like makes me angry all over again. At least someone could have connected her to a healthcare provider, at least given her a phone number to say, call this place and get an appointment. But even that, we know, I mean, we have enough data to show when you give someone a phone number, most of the time they don't call it. So we really have to bridge that gap for patients, especially people being discharged from the hospital. So I think technology, it has to be an enabler, you know, it has to be a complement. For some folks, it's not going to be enough.
When we were talking about technology, one of my thinkings is if we think of it as a relay race, right? You have one provider that needs to hand off to another provider, and we're relying on the patient to make that handoff. What if technology helped the provider make that handoff? So if the provider knows, okay, this person doesn't have a PCP, what if we had something that would help the provider find the PCP, get the appointment booked right while the patient is there, instead of putting it all on the patient's shoulders?
The healthcare system just sent somebody back out into the community without a clear understanding of what's happening to her, without a clear understanding of next steps. We know that she doesn't have a primary care provider. I mean, that's a lot to ask of an individual to navigate.
If we can get innovators to actually take the time to talk directly to the end user, then we'll see we'll see better uptake of a lot of these innovations. There's so much stuff out there, but it's just not being used. And I think that's the reason, because people think they already know what the problem is, but they're not talking to the people they want to build it for.